you ever wondered why you have certain phobias and how you can fix it? Let's talk about it. Hi, guys, welcome to episode one of the Psychology in Everyday Life series. And today we're going to be talking about psychology and phobias, why you develop them, and how you can possibly fix them. So, I'm going to be using myself as an example just to give you guys a practical example. So, me, for example, I'm scared of worms, centipedes, maggots, anything that crawls just freaks me out. So why did I develop this phobia? Well, since I was little, I didn't always have this phobia, but there's a reason I developed it actually. I had a friend who had a brother, and I don't really know what happened, but I know we were in school that time, and I think we were playing or something. Then there was was it a caterpillar? I can't really remember what happened, but something burrowed into like the surface of his skin, and they had to like get it out. And from that day on, I was just like traumatized. Like, so this thing can enter my skin. And then I started to generalize it to basically anything that was crawling. And now I've just like sort of grown up with that phobia to just be scared of things like that. So sometimes the reason why we actually develop all these phobias is because of what happened during our younger age. What made us associate this thing with this thing? Like some people now, they are scared of needles. Maybe in their younger age something happened, maybe a needle broke in their skin during an injection, so you start to associate that such of trauma, that kind of trauma with these things. So once you start to associate a bad event or a traumatic event or a sort of fear with something, you automatically start to fear that thing, and that is how that becomes a phobia. Like in the little Albert experiment, the scientist John Watson, he used a small child, Albert, and in the experiment, every time Albert went to a fluffy rat, the experimenter will come with a loud metal and then make a loud noise behind the child's ear, and the child will automatically be scared and then drop the rat. So the child didn't know that the loud noise was coming from the experimenter, obviously. What the child felt was that every time he carried the rat, that's where the loud noise comes from. So he associated that fear of that loud noise with the rat and then started to fear the rat. And soon enough, he started to generalize anything that was white and fluffy, he just feared it, whether it was a rat or not. So that's how phobias come: association and then sometimes generalization. Then, how can we fix it? Well, it's simply just the opposite. Associating positive things with the thing you fear can help you start to generally feel better towards it and stop fearing it. Now, you may be like, does that really work if I know that they're trying to fix my fear? Well, sometimes in CBT, cognitive behavioral therapy, actually, the patient knowing that you are trying to help them out does really help, because then they are more open to get these skills and see how they can manage their fear actually. So yes, knowing that you're trying to fix your fear does help. So you can start by associating positive things with that thing you fear the most, and then you're gonna solve it. So that's basically just my little take on psychology and how it relates to phobias. And bye for now. Stick around for episode 2. See you later, guys.